Hello, my name is Christina Porter and I'm a student at Eastern Kentucky University in the Family Nurse Practitioner track. I have prepared a presentation on the benefits of incorporating motivational interviewing into standard smoking cessation programs to improve adherence with smoking cessation. First, it is important to understand what cigarette smoking is. Cigarette smoking is the inhalation of smoke from burned tobacco. Next, it is important to understand the magnitude of this health issue. Cigarette smoking is the leading cause of preventable death in the United States, causing more than 480,000 deaths each year in the United States. Cigarette smoking contains more than 7,000 chemicals, including hundreds that are toxic and about 70 that can cause cancer. Every year, there are about 7,300 people who have never smoked before that die from lung cancer due to secondhand smoking. These statistics demonstrate how cigarette smoking leads to many deadly and preventable healthcare problems. I have found two research studies that demonstrate the importance of utilizing motivational interviewing. The first study was performed by Lindquist et al. In 2013. This study is a Level 2 randomized control trial, which included 772 participants. The purpose of this study is to assess the effectiveness of motivational interviewing on smoking cessation. The setting of this study included the Swedish National Tobacco Quit Line. Participants who called the Swedish National Tobacco Quit Line were assigned to a standard counselor or motivational interviewing counselor based on which type was available at the time that they called. Smoking cessation data was collected using self-reported point prevalence and self-reported continuous prevalence abstinence. The intervention group included a telephone counseling session with a motivational interviewing counselor who received a 2-day workshop on motivational interviewing. The control group included telephone counseling sessions with a standard treatment counselor who received 40 hours of training in standard counseling. This study revealed that there is no significant difference between motivational interviewing and standard treatment clients for point prevalence abstinence. However, this study did demonstrate a significant difference between motivational interviewing and standard treatment for continuous abstinence. This study demonstrates the effectiveness of motivational interviewing for long-term smoking cessation. The second study was performed by Calabro et al. In 2012. This study is a Level 2 randomized control trial with 236 participants. The purpose of this study is to assess the effectiveness of motivational interviewing with web-based support on smoking cessation compared to standard care. The setting of this study included a tobacco-free college campus located in southwestern United States. Self-reported abstinence was used to determine smoking cessation, where participants answered yes or no to certain smoking cessation questions to determine smoking status. The intervention group received 30 to 60 minutes of in-person motivational counseling with health feedback in an internet-based program that included 5 sessions. The control group received a smoking cessation self-help manual from the National Cancer Institute and 2 subsequent in-person visits lasting about 5 minutes each. The findings from this study reveal that there is a significant difference between motivational interviewing and web-based support in treatment for smoking cessation at 12 months. This study also demonstrates the effectiveness of motivational interviewing for long-term smoking cessation. These studies demonstrate increased smoking cessation with the use of motivational interviewing. These studies also demonstrate that this method of smoking cessation is very accessible, since it can be administered in person or via telephone. It is important for the family nurse practitioner to stay up to date on the best current practice and make those available to their patients. By recommending patients to programs that use motivational interviewing for smoking cessation, the family nurse practitioner can help their patient population be more successful with smoking cessation. Increased success with smoking cessation means less serious chronic health care problems caused by smoking cigarettes. Counseling combined with nicotine replacement therapy is currently the most effective form of smoking cessation help. Even with help, many people who attempt to quit smoking start again due to withdrawal symptoms, including increased stress and weight gain. To help increase smoking cessation adherence, we need to start utilizing motivational interviewing. What exactly is motivational interviewing? Motivational interviewing is a new method of counseling that may increase effectiveness of smoking cessation programs. Motivational interviewing is a collaborative, patient-centered form of communication designed to guide and strengthen motivation for change and focuses on the individual's own values and concerns. Incorporating motivational interviewing into standard smoking cessation programs can increase success of smoking cessation. Motivational interviewing can be implemented in the inpatient setting. As a nurse practitioner, it is important to be aware of all resources available to patients. The family nurse practitioner should screen all patients for smoking status at every visit. All current smokers should be referred to a program that utilizes motivational interviewing, since it can significantly increase adherence with smoking cessation. Programs that do not currently use motivational interviewing can train counselors on how to effectively incorporate motivational interviewing into their sessions. If you have any questions about my presentation, please feel free to email me. I have provided my student email on the last slide of the presentation. Thank you so much for your time. I hope you have found this presentation to be beneficial to your future practice.